we are looking at the pathological fractures. So we start with our question, that is, in case of the primary malignant tumor. So what are the primary malignant tumors which leads to this condition? So in this video we'll find these answers and learn in detail about this topic. So to start with, firstly we have the definition of the pathological fracture. Pathological fracture we need to know. So what does it mean? The pathological fracture, it occurs with a normal stresses. It occurs with normal. There is normal stresses. It occurs with the normal stresses in bones. Occurs with normal stresses in bones that have been weakened by change in structures. So these have been weakened. It has been weakened by change in structure. By change. There's a change in the structure. There's a change in the structure as well as or through a lytic lesions So this is the definition of the pathological fracture. Then we look at the factors suggestive of a pathological fractures. So factors suggest it's a pathological fracture. So what are they? So it includes the fracture after minor trauma. So there's fracture after minor trauma. So now let's just recap what we did. So we discussed about the definition of the pathological fracture. So pathological fracture, it occurs with the normal stresses and in the bones that have a weakened. So in bones that have weakened, that have weakened by a change in the structure. So they are weakened by a change in the structure or through lytic lesions. So this is the definition of the pathological fracture. Now then we also looked at factors. So factors suggestive of a pathological fracture, it includes the fracture after the minor trauma. So this is what we saw here. Now we'll be continuing with other factors. And the other factors, it includes pain. It includes pain at site. Pain at site before the fracture. Pain at site before the fracture. And also the multiple recent fractures. There's multiple recent fractures, and there's also history of the primary malignancy. There's history of primary malignancy. Now we'll be jumping to our causes. So what are the causes of this? So under causes, firstly we have the generalized bone disease. We have something known as a generalized bone. There is a generalized bone disease. So what does this generalized bone disease include? So this includes the osteoporosis. Next, there is also the metabolic. There is also the metabolic bone diseases. There is metabolic bone diseases. Then there is also the osteogenic imperfecta. Osteogenesis imperfecta. Followed by, there is also the Paget's disease, and there is the polyostotic fibrous dysplasia, and there is the myelomatosis. So just to recap what we did here, we saw some characteristics of the factors which suggest of the pathological fracture. So here we were left out with some points, that is the pain at the site before the fracture. Then there is also in case of the multiple recent fractures and history of the primary malignancy. Now when we go about the causes, there are various headings. The first one being the generalized bone disease. So what has a generalized bone disease? So this includes the osteoporosis. There is also the metabolic bone diseases. There is osteogenesis imperfecta. There is a Paget's disease, as well as there is a myelomatosis. Then we'll also look at the other generalized bone disease. We are left out with one more, that is the polyostotic fibrous dysplasia. Let's write it down. polyostotic fibrous dysplasia. So then we look at the local benign conditions. The local benign conditions. So under the local benign conditions, it includes there is chronic infection. There is chronic infection. Next, there is solitary. There is solitary bone cyst. Then comes the aneurysmal. The aneurysmal bone cyst, as well as the chondroma. So just to recap, we saw the generalized bone disease. So under that, it also includes the polyostotic fibrous dysplasia. Then looking at the local benign conditions. So local benign conditions, it also includes there is a chronic infection, there is a solitary bone cyst, there is an aneurysmal bone cyst. So bone cyst, there is solitary as well as the aneurysmal. Then there is also the presence of chondroma. Next, we look at the primary malignant tumors. So primary malignant. The primary malignant tumors. So what does this primary malignant tumor include? So the primary malignant tumor, it includes, there is a chondrosarcoma. There is a chondrosarcoma. Next, there's also the there's an osteosarcoma, as well as the Ewing's tumor. The Ewing's tumor. Then we look at the metastatic tumors. The metastatic tumors. The metastatic tumors, it includes the metastasis from the breast, next the lung, then the kidney, the thyroid, the colon, as well as the prostate. So just to recap, we saw the primary malignant tumors. So the conditions, it includes the chondrosarcoma, then the osteosarcomas, so basically the sarcomas, and also the Ewing's tumor. So then the metastatic tumors, what does it include? It includes the metastasis from the breast, lung, kidney, thyroid, the colon, and the prostate. So now we'll be answering our question. So the question we asked was, in terms of the primary malignant tumors. Primary malignant tumors, what are the conditions? So this is nothing but a cause of the pathological fracture. So the components it includes are the there is a chondrosarcoma. So after chondrosarcoma, there is also the osteosarcoma and the Ewing's tumor. So just to recap, we saw the primary malignant tumors. It includes the sarcomas, that is a chondrosarcoma, osteosarcoma, as well as the Ewing's tumor. So this was about the pathological fractures. To learn and grow daily, please do subscribe.